Hello everyone, I'm Sotiris Vardoulakis. I'm Professor of Global Environmental Health at the Australian National University, and I will present the HEAL Network, a new Australian initiative in human health and environmental change that aims to catalyze research, knowledge exchange, and translation to policy and practice that will bring measurable improvements to our health, the Australian health system, and the environment. First of all, I would like to acknowledge the traditional custodians of the land I'm based at, the Aboriginal Torres Strait Islander people, and pay my respects to their elders, past, present, and emerging. I would also like to acknowledge the Australian people who lived through the catastrophic bushfires of the Black Summer of 2019-2020 and suffered in the smoke or lost loved ones, properties, and animals. That was a manifestation of climate change. And it's increasingly recognized that climate change is not just an environmental problem. It's the greatest global health threat that we're facing in the 21st century. Mitigating and adapting to climate change can also bring multiple benefits. So climate change can also be seen as an opportunity to do things differently and improve health. In COP26, health was chosen as a science priority area. Health is also in the center of the Sustainable Development Goals, and we're now in the decade of action. Health is interconnected with equity, climate action, environmental protection, and economic growth. All these are interdependent. We cannot have one without having the rest. In Australia, we're at the forefront of environmental change and climate change. We experience extreme weather events like heat waves, droughts, floods, and bushfires. We also experience slow burning environmental stressors like air pollution in our cities and the overheating of the built infrastructure that have impact on cardiovascular, respiratory health, and mental health. Pollution of our soil and water, contamination of the seawater, of the coastlines, of the soil, including micropollutants and microplastic contamination is a major problem also in Australia and globally. And also, environmental change interacts with the vectors of disease like mosquitoes and many other infectious diseases, including COVID-19 and respiratory infections, as they are affected by the way we interact with the environment, both indoor and outdoors. The health sector is also a great emitter of greenhouse gases. So we know that in Australia, the health services emit around 7% of the national carbon dioxide emissions. And we need to reduce the impact of the health sector on the environment. We also need to improve the resilience of the health sector to extreme events, to surging demand from disease outbreaks, and also to environmental pollution. If we act rapidly to improve resilience to environmental change, to reduce greenhouse gas emissions, to mitigate climate change in our cities and communities, we can improve health directly. And this is through better physical activity, through more active travel, more walking and cycling, through the electrification of the vehicle fleet that will reduce air pollution in our cities, through healthier diets that will reduce greenhouse gas emissions from the agriculture and farming sector, through clean energy in our houses that will reduce indoor and outdoor air pollution and improve thermal comfort, through better and larger and better distributed green spaces that will reduce the urban heat island effect, improve opportunities for amenity, recreation, physical activity, and mental health, and also through preventive health that will reduce the pressure on health services. The aim of the HEAL network is to provide the evidence, build capacity and capability, and the tools urgently needed to develop these solutions in urban, rural, and remote communities in Australia, and provide an example internationally of environmental change, adaptation, and mitigation. That will improve the community, the health of the community, provide opportunities for sustainable development, strengthen the health systems, and will also reduce inequities and inequalities. The HEAL network is a very large coalition of 100 investigators from across Australia, around 30 institutions, including universities, health departments, and environmental protection agencies. Importantly, the HEAL network includes policymakers, data providers, indigenous organizations from across Australia, and health sector organizations. And as you can see here, it's very well distributed. It has regional hubs across all states and territories in Australia, and also communities of practice that bring together local researchers, policymakers, businesses, charities, communities to co-design research to address the local needs. The HE network has a number of fundamental enablers, and this includes its democratic structure. It's a very interdisciplinary network. It has a focus on Aboriginal and Torres Strait Islander health. It has a strong focus on health system and also on engagement and communication. And these are the cross-cutting themes of the network. We also have a number of research themes which are more specific on health system resilience and sustainability, bushfires, air pollution and extreme events, food, soil and water security, biosecurity and emerging infections, urban health, rural and remote health, and at-risk populations. And we have a number of priority actions that will bring the network together to develop a national environmental health risk assessment, establish the HEAL Observatory, which is an online knowledge action hub, set up a pilot sustainable health unit that will track the healthcare's environmental performance, and we'll also develop a story data atlas integrated Indigenous and Western knowledge systems, and that will protect and improve health, strengthen the health system resilience and sustainability, empower Indigenous communities and researchers, and reduce inequities and inequalities within and across communities and generations. The HEAL network builds on a number of initiatives in Australia and internationally. We interact and collaborate with the inVIVO Planetary Health Network and many other global initiatives, and everybody is welcome to join us and provide their input, experience, contributions, interact with the HEAL network, which is now funded by the NHMRC, the Australian Health Research and Medical Research Council for 5 years. We have substantial funding and resources, and a group of a coalition of researchers and practitioners that will make that happen. We had our first conference in November 2021. We had a great response, over 900 registered participants. It was a hybrid conference with net zero emissions, zero air travel, zero paper waste, and zero food waste. And we're aiming to expand our network and have regular meetings. Please stay in touch. Please contact me if you want to know more about the HEAL network. Thank you very much for your attention.